joining us tonight. This is another installment of NVFP's Town Hall, and we really appreciate you all coming tonight. Before we get started, I think this is a very timely opportunity to let you all know that we have COVID and flu vaccines, and this is a great time to go and get them. And so if you haven't gotten yours yet, please go to either your local pharmacy or the health department, or obviously give us a call. We have flu clinics Tuesdays and Thursdays. You can do it for a regular nurse's visit, however you want to get it. Certainly want to make sure that you get your flu and your COVID shots this year, preferably before probably the beginning of December. So just give us a call if you're not sure if you need to get it, or if you're not sure how to get it, but we're happy to give it to you or tell you where you need to go. But we highly recommend that. With that said, we are also giving this timely talk today because there is a lot of information out there in the news, regardless of where you get it. That I'm hearing a lot of questions from people, skepticism about vaccines, lots of questions. People aren't sure what to believe, what they hear, where they get their information. We decided that this would be a good talk to have because as physicians, we get all our vaccine information from things like the New England Journal and from JAMA and from research papers. Getting your vaccine information from Fox News or MSNBC is probably not a great resource for you. So we decided to have a presentation to hopefully cut through a lot of the misinformation or unfortunate things that are out there and just go straight to the science. And so we invited Dr. Nithya Swamy to join us today. She is an allergist and immunologist in the Arlington area, and a wonderful allergist and immunologist at that. And Dr. Swamy went to UT Austin for undergrad and then got her medical degree from the University of Chicago School of Medicine, and did residency in Texas Health Presbyterian Hospital, and then did a fellowship as well, and is board certified in allergy and immunology. And the best compliment I can give Dr. Swamy is that I am a patient. So I'm very happy to have her today, and I appreciate you coming, and looking forward to what you have to say.
All right. So hello, everyone. Welcome. I'm giving a talk on vaccines, as Dr. Zweig said. And so I'm going to go through kind of the basics, the science of it. It's going to get into politics a little bit, but and then we'll go into kind of how vaccine safety and the guidelines and things like that as well. So just to start, so this is just the objectives of this, or to go over kind of why vaccines matter, explain the core immunologic mechanisms, go over kind of vaccine surveillance safety, the process that vaccines go through before they're approved, and then interpret kind of the U.S. immunization trends, and then discuss barriers, hesitancy, programmatic challenges, and then apply strategies to improve vaccine uptake, and then finally the future of vaccines. So.
And do you mind if I just interrupt one
Yes.
second? I forgot to mention that if anybody has any questions, you can go ahead and feel free to put them in either the chat or the question and answer section. We'll wait till the end, hopefully, and then try to get to them as much as we can, but feel free to put them in as we go. Sorry about that. Sorry to interrupt.
No, not at all. So why do vaccines matter? Essentially, they rival clean water in terms of public health impact. They've been saved over 154 million lives in the past 50 years. And also they are credited to have dropped 40% of infant deaths as well due to their success. They prevent diseases like COVID-19, measles, whooping cough, influenza, HPV, among others. And a lot of these illnesses can lead to severe complications and even death, especially in infants, the elderly, and those who are immunocompromised. And so they also induce something called herd immunity, which basically means that enough people in a community or area have achieved protection or immunity against an infection to make it very difficult for the infection to spread. And so it also protects those who can't be vaccinated, like newborns and those with certain medical conditions as well. And they do have a high return on investment. They essentially prevent disease, which is far less expensive than treating it. They reduce the hospitalizations, long-term complications, and even economic productivity. There's improvements in that since the vaccines have come into play. And then the CDC estimates, I think it's about $1 spent on child vaccines save over $10 in healthcare costs. So in basic terms, vaccines essentially mimic natural infection without causing disease. So this, in terms of complicated terms, they get into this, they produce this antigenic component, which is just the part of the pathogen, and that it activates the immune system, which activates these types of white cells called memory B and memory T cells. And the immune system essentially remembers the pathogen. So upon re-exposure, it mounts a rapid and very robust response. And so that neutralizes the infection before the illness even develops. And so that's kind of the basis of the protective immunity. And so we have these antigen presenting cells that essentially process the vaccine proteins. They present them to these other types of white blood cells called B and T cells, and that triggers this certain lymphocytes that are memory B cells, memory T cells that essentially remember this in vaccine protein and are able to elicit the antibody response when you're exposed to those, the infection, essentially. And to lead to long-term protection after that vaccine exposure, those memory B cells are the ones that essentially maintain the protective antibody titers. And so vaccine efficacy essentially depends on that host immune status, those antigen characteristics, and the vaccine formulation. And the immunization schedules are designed to optimize the timing for when those boosters are needed, for those who have waning immunity or for underdeveloped immune systems like in infants or the immunocompromised. And having a better understanding of these immunologic mechanisms is really important for evaluating those vaccine responses and interpreting the level of protection for some of the vaccines. And so these are the most common types of vaccines that are available. So there's the live attenuated, which have the weakened pathogens that essentially replicate the infection, and they allow kind of the mimic a natural infection, I'm sorry, and they elicit a robust kind of long-lasting immunity. And they can't be used in immunocompromised or pregnant patients because it's a live vaccine. And then there's the inactivated or killed vaccines, which they have proteins that have been inactivated by heat, chemicals, radiation, and they can even, those cannot replicate. And so the immune kind of stimulant relies on the antigen recognition, which is the protein that's presented. And so they elicit kind of a weaker immune response, and they often require multiple doses or periodic boosters to sustain the response. And they are safe in immunocompromised patients. And so that's kind of hepatitis A, polio, the rabies vaccines are examples of those. And then there's the subunit recombinant polysaccharide and conjugate vaccines. They have also have a good safety profile. They have specific antigens, specifically like proteins, polysaccharides that are derived from the either virus or pathogen, and they don't have the entire organism. So the immune system is highly targeted to that immune response. And it also requires kind of certain proteins called adjuvants that enhance that immune response. So another kind of effective treatment. And then there's toxoid vaccines, which have inactivated bacterial toxins that stimulate the production of those protective antibodies. And it's against that toxin as opposed to the bacteria itself. So examples are the diphtheria and tetanus vaccine, and it's very effective for those toxin-mediated diseases, but you do need to get boosters about every 10 years to stay up to date. And then there are the mRNA vaccines, which are the COVID vaccines that we have available. So they basically deliver this messenger RNA, and they encode a pathogen-specific antigen. And so it's usually a viral surface protein. And then the host cells essentially translate the messenger RNA into antigen, and that triggers these B and T cell responses. And they're non-infectious, and then a non-integrating platform. So they're rapidly adaptable to even new emerging pathogens as well, but they do often require boosters. And then finally, the vector vaccines. They use like non-replicating viral vector to deliver kind of the genetic material to the target antigen. The problem with these vaccines is sometimes the immune system can target the vector itself as opposed to the pathogen that the vector carries. So that's the only issue, and that can lead to a weakened immune response. And then for vaccines to be released, it goes through an extensive training process. So essentially, it starts with like cellular and animal models, and it's followed by phase 1 to phase 3 clinical trials with progressively increasing populations. And then after approval, the vaccines, they undergo continuous safety monitoring to detect or rare or delayed events that are not seen in those trials. And finally, there are safety monitoring systems that are in place by the FDA, CDC, World Health Organization, and then there's now also active monitoring systems through the electronic medical record as well. And then looking at vaccine safety, vaccines have dramatically reduced or even eradicated many deadly and debilitating diseases like smallpox, measles, polio, meningitis, and a person is far more likely to be harmed by a vaccine preventable disease than by the vaccine itself. And so minor side effects, those can be more common, but they're generally short-lived. Often they can be a local reaction, so a sore arm, localized redness. Sometimes you can have muscle aches or joint aches, headache, fatigue, and a mild fever. The more serious side effects, those are extremely rare. They can include severe allergic reactions, something called Guillain-Barré nerve polyneuropathy, and seizures as well. And so the benefits of the vaccine far outweigh any risks by preventing the disease, any hospitalizations or death. And there's no credible evidence that links vaccines to autism, autoimmune disease, or infertility. There's multiple large-scale studies that show their safety. And then this is a summary of the vaccines recommended throughout the lifetime as it is now, but I won't go into too much detail on this. And then to summarize kind of the vaccine coverage trends in the US. So adolescent vaccines like HPV, diphtheria, tetanus, meningitis, those are trending upward. And so that can reflect effective school and provider programs. However, the early childhood vaccines, so MMR, diphtheria, tetanus, varicella, those have some concerning declines. And the national coverage is now around 91 to 93%. And typically 95% is what's recommended to induce the herd immunity. So we're below that. And then for adults, coverage of the COVID-19, as expected, increased, as did shingles, but there's been declines in the COVID boosters and influenza boosters. So, and then also the pneumonia vaccines in adults who are 65 and older have decreased, but they've remained stable in at-risk adults who are 19 to 64. And so, as you can see, along with the declines in the vaccine coverage, there has been resurgence of several vaccine preventable diseases post-pandemic that have been previously near elimination. So measles and pertussis stand out with the steepest increase, with measles rising over 100-fold from very low case counts in 2020. And then pertussis shows an 8-fold jump. And the pertussis, that in part can increase due to waning immunity from the vaccine, but the majority are due to missed childhood vaccines. And then influenza and RSV also increased once the COVID precautions were lifted. And so that exposes something called an immunity gap, where lack of exposure to these viruses led to low to absent natural immunity. And so the new RSV vaccines that were just introduced in 2023 are helping curb that incidence, but it hasn't reversed that upward trend. And then hepatitis A continues to cause outbreaks, particularly among unvaccinated adults and in high-risk settings, such as homelessness or substance use. And then for pneumococcal disease, we're seeing a modest increase, more likely reflecting that declining uptake in the older adults. And then there's also was a delayed rollout of newer pneumococcal vaccines. They're called PCV15 and PCV20. So this is a big slide. So I don't think we have time to discuss all the barriers to vaccination, but I'll try to summarize them the best that I can. So the World Health Organization identifies vaccine hesitancy as a top 10 global health threat. And this is due to misinformation from social media and pseudoscientific resources, distrust towards the government, pharmaceutical companies, and healthcare institutions. There's also an imbalance in the perceived benefit versus risk ratio with a significant fear of vaccine side effects. And there's also imprecise beliefs on natural immunity. Now, to me, we are in a scary time for policy and regulatory barriers. So the federal government has made some drastic changes to vaccine policy, as you all may know, and funding this past year. They weakened some of the vaccine recommendations for children and adults. They halted research for funding for vaccine development, and they slashed funding for federal, state, and local public health practitioners who work in immunization efforts. So some states are likewise implementing some anti-vaccine policies as well. And so they are reconstituting advisory panels with members who have more anti-vaccine views, which also raises concern about the evidence-based nature of future recommendations for these vaccines. And then, so how do we get past these barriers? So we first need to strengthen our access and infrastructure. So we need to make vaccines more available in pharmacies, workplaces, community clinics. And then I think we need to implement reminder recall systems, so text and EMR alerts, eliminate cost barriers through programs like Vaccines for Children or externally funded adult immunization programs. We should target special populations like the underinsured, immunocompromised, and older populations, pregnant individuals as well. And so one of the strongest things that we can do as healthcare professionals is to build trust and communication with the patient. So we have to lead with empathy and respect and acknowledge the patient's concerns and try to address any misinformation just directly and calmly, and just emphasizing the data and the benefits over the risks. And then I think that, in terms of policy and system support, so this is also a tough one, as we've lost some highly educated evidence-based experts from the organizations that are responsible for guiding these vaccine policies and mandates. And so it's a challenging thing to kind of go up against now, but we should do our best to just support the clinical evidence when we can, endorse school and workplace vaccination requirements, and then streamline state immunization registries for better tracking and reminders, and use technology and outreach by employing even like digital registries or educational videos, mobile vaccination teams to go out into a wider audience. And I do feel cautiously optimistic that we can make a difference, even when it is an uphill battle. And so what should we expect to see in the future? So we have the COVID-19 mRNA vaccines, but they are being studied to treat various infectious diseases like all coronaviruses, HIV, malaria, tuberculosis, hepatitis C, even C. diff. And they're being studied to treat food and environmental allergies, autoimmune conditions, and malignancies as well. And so the goal of these vaccines is to produce a more durable immunity with the smaller doses. In August 2025, though, the HHS terminated 22 mRNA vaccine development projects, and they cut nearly 500 million in grants and contracts administered through BARDA. So that is going to affect mRNA vaccine research in the US. DNA vaccines use engineered bacterial plasmids that carry a gene which encode for a specific antigen. And then once injected, those cells kind of take that up and they produce the immune response. And so this has shown a good potency in I guess animal models, but it hasn't shown as strong in human studies. But they are working to see if they can improve that. And then the vector vaccines, which just essentially use a harmless virus or bacterium, which they deliver the genetic material into the body, and then that stimulates an immune response. And they can be used to target a wide range of pathogens, including bacteria, viruses, and even parasites. And then the VLPs, those mimic the viral structure, but they essentially lack the viral genome. So they're safe and effective at presenting kind of the viral protein antigen to induce that immune response. And they induce it in the virus's native kind of configuration. So it is a more kind of targeted and accurate response as well. And then nanoparticles, those can display multiple antigens and they target specific immune cells and enhance durability. Vaccinology is more computational approaches. And then they're also developing universal or multivalent vaccines, which are designed to protect against multiple strains or variants of a type of infection, so such as influenza or coronavirus. And then therapeutic vaccines are being examined to move beyond prevention and actually treat the existing diseases, and that even includes cancer and chronic infections. And then finally, innovations like microneedle patches, biodegradable implants, intranasal, sublingual, and oral vaccines are all being developed. And hopefully those needle-free options may enhance the vaccine acceptance too. And overall, the emerging vaccine technologies, they represent a paradigm shift. So faster development, broader immunity, greater adaptability, and improved access. So for practitioners, understanding that platform is key to kind of optimizing the vaccine use, patient education, and policy integration as well.
Great. Well, good. All right. I think that was terrific. Thank you so much.
Of course.
That's great. So as we said before, if anybody has any questions, I see there's already one there, but if you want to add any questions into the Q&A section on the bottom of your screen, or put it into the chat, we would be happy to answer them however we can. I have a couple questions myself. When we start, there's one from one of the patients that says, I don't know if you can answer this, but with the government shutdown, is there a concern that the CDC is not able to monitor and track viruses? No.
There's still kind of people in play that are monitoring it, but there has been several that have been cut back and not able to do so. So I don't know the extent of kind of the monitoring. I just know that there's been some effort to kind of maintain that, but I know that there definitely has been some cutbacks, of course, too.
And my understanding also is that there are some cutbacks, but that the states are still functioning. So the Virginia Department of Health is still doing it. It's not as adequate across state lines, but at least in our local area, the Department of Health, the Arlington, Alexandria, and Virginia Department of Health are still functioning to monitor for vaccines that are going to be a problem. So I guess only time will tell, but hopefully it will be just fine. I had a question for you. Obviously the mRNA, one of the concerns for it is that they say that it changes your DNA, or it does, things that are permanent alterations to you. If you wouldn't mind speaking to that, because that's one of the concerns that a lot of people have about the mRNA vaccines.
Yeah, so those do not affect our own DNA or our genome. They essentially, contain the viral mRNA particles, and that kind of is what just induces an immune response. Just like with other antigen or producing vaccines, you're inducing this antibody response by exposure to the actual RNA of the virus, but it doesn't affect our RNA, DNA, our genome whatsoever. It's just more targeting the immune response, and it targets specific immune cells that are involved in antibody production and creating that. And it has a more robust response than the other vaccines that have been on the market, which is why it's being used for coronavirus. And it's easily adaptable as well. So, we are able to kind of modify when needed, as we have been with the COVID boosters or as they have been with the COVID boosters.
I always like it to like a car factory.
Yeah.
The factory makes a bunch of cars, and let's say it's making a bunch of red cars, and this is a signal that says, "Hey, make blue cars." So all of a sudden, you get a bunch of blue cars. You haven't done anything to the factory. Nothing else has changed. Just what's changed is coming out for a period. And then as soon as that that signal goes away, it goes back to doing what it was doing before.
And it's the way that it works. Yeah, it's only affecting the immune system that's producing those antibodies. It's not going into any other kind of part of our organs or anything like that.
And then Ed Ward is asking regarding emerging therapies, what is the prospect for them in the current DHS funding philosophies?
So I think that's
these are getting tricky outside the medical realm, I guess. But yeah.
That's a good question. I'm not sure. I mean, like a lot of those kind of cuts to funding have been pretty recent. I think the one cut to the mRNA was just in August, and so I think there were a couple studies that were allowed to go through, but there was quite a few that were cut back. So to the extent of what that's going to mean, I think we have yet to see, but it's definitely not a good thing.
I guess my take is, it's certainly going to be new vaccines. The research and whatnot is going to be significantly slowed and set back, at least in this country. And I think we're going to be able to have access to all the vaccines that we've had access to all along. But as a matter of coverage and whatnot, that remains to be seen as well, because commercial insurances tend to follow Medicare's lead. So it really depends on what Medicare does with these. We'll just have to wait and see, but we're certainly, we are big fans, and we'll do everything we can to help our patients, at least, to get the vaccines that they need and that they want. So, another question I had for you. So let's say, a lot of these vaccines have 2 or 3 vaccines that are needed as boosters over a scheduled series. What happens if you don't follow the schedule exactly, or you miss your 3rd dose? What can you do at that point?
So essentially, you lose that immunity that you gain from the initial vaccine. So you need those booster doses to complete the immunity, because there's some pathogens that when we're exposed to it and produce those antibodies, we lose them over time. And so to kind of reintroduce those antibodies and reintroduce that protection, it's important to get those booster vaccines, because they're not a lifelong effective therapy, just like we have turnover in other parts of our body. Just the same thing with the immune system. Those antibodies over time dissipate. So it's important to get revaccinated to keep that protection up.
But what if you're 2 months late? If you're like
hepatitis B, you can still get it. Yes, you should get those booster doses, even if you're late. So because you can kind of catch up to it. So it's better to get it than not.
I get that question a lot in my practice as well. So so good. All right, great. And then Robert Thompson asks, will leadership in vaccine development and knowledge shift to some other part of the world? It's a good question. If you ever thought about that.
I think so. There's a lot of interesting studies coming out of India, China, Europe as well, that are, where they're kind of advancing. So I do think that we'll see more evidence. A lot of these, because there's also kind of polio and measles are starting to outbreak globally, and so as well. So there are definitely studies to look into that and protect against that. Oh, in Africa as well, in terms of yellow fever, that has been on the rise, and Ebola. There's been kind of vaccine development being studied in those countries as well.
Yeah, and a lot of the diseases that we deal with here do start in other countries, obviously, and migrate to us. And so certainly there's an interest in the whole world getting involved in this. And, there is good research being done in other places as well. So we just hope that that research gets done in a reasonable amount of time.
Yes.
We already got through one global pandemic. I think we are probably good for a little while. Usually it's about every 100 or 200 years. So hopefully we won't have to deal with it too much in the near future. So if anybody has any other questions, you can put them in now, or you can always add them afterwards, and we can always try to answer them later as well. And my last question for you is, I'd like to know which part of Arlington is that photo, because
So that's at the Grand Tetons.
that's beautiful. Yeah.
Yeah.
Yeah. Well, good. All right. It looks like there's no other questions, but I think that was really helpful. It was a great presentation. Really appreciate it. So
Of course.
hopefully that was helpful for everyone who attended. Thank you. And obviously her information is there. If you want to get in touch with her, I guess you can email her. You can also contact us, and we can always get you in touch with Dr. Swamy. And she's a great resource for us as well. So I really appreciate your time. There is a question in the Q&A. We already got to that one. Yeah, so I think that's the only question that we have. Looks like that's the only one. Yeah, so we already got to that question. So, all right, great. Well, oh, here we go. I'm sorry. Do recommendations for COVID vaccines differ for young adults?
In terms of, which, how do you mean? I guess it's in terms of the government policies or what the science shows. But the science shows that the young adults should also be getting the boosters annually and have their vaccines updated so that they are protected to the new COVID antigens that are being produced or mutating.
Yeah, actually, if I could make one more point, is one of the things that I get a lot is that, vaccines are not perfect. As you alluded to, there can be side effects, and they're not 100% effective either most of the time. And so one of the things like COVID or flu, certain vaccines, they may only be 40, 50, 60% effective at preventing the disease. But more importantly, what we're really trying to do with vaccines is prevent complications from the disease. People, if you get the flu and you're sick for a couple of days, you miss work, that's too bad, but it's not the worst thing in the world as long as you get better. But if you get the flu and you have complications, you end up in the hospital, or you have pneumonia or some other complications with it, obviously or God forbid death, obviously that's a much bigger deal. And so when we hear these numbers that it's only 50% effective or 60% effective, that's only 50 or 60% effective at preventing getting the illness. But the flu shot, the COVID shot, a lot of these other ones, the shingle shot, what they're really good at is 90, 95%, 98% effective at preventing complications, long-term adverse outcomes or death. And that's where some of the misperception, I think, also comes in, is that, oh, I got, the shot and I still got sick. Well, okay, you missed a couple of days of work, or you may have had something that had nothing to do with the flu or COVID, but it felt like it. And then you got back and you were fine. But shots, these vaccines, what they do very well is keep people out of the hospital, prevent death, prevent long-term complications. And that's where their best performance is, I think, in a lot of these cases. And so that's an important point, I think, to make.
Definitely.
Yeah. But yeah, good points. So, all right. Well, great. Well, I think that is about it. But thank you so much. Some tough questions were thrown your way, so I appreciate you feeling those. And really appreciate your time, and appreciate everybody for joining in. Hope everybody has a great night.
Take care.
Take care. Thanks again.